Dexamethasone. Did you know that this drug has a negative effect on growth in children? What exactly is this medication? What diseases does it help us fight? What are the routes of administration? And what forms will we find this drug in? What happens to my body when I take a dexamethasone tablet or receive an injection of it? What effect does it have against COVID-19? We'll discuss the contraindications, when this drug should not be taken. Are there any precautions to take with this medication if I'm also taking NSAIDs, warfarin, or any other medication? What are the side effects of taking this drug? Stay tuned until the end because we'll answer all these questions. We are the Guamit Project. Let's begin. Dexamethasone is a long-acting synthetic corticosteroid. It is also called a corticosteroid. These corticosteroids are hormones that a healthy person already produces naturally thanks to our adrenal glands. And what are the routes of administration for this drug? As a key point, dexamethasone is available in oral preparations in 80–85% of cases. What does this mean? It means it's most commonly found in tablet form. Many people choose to keep this medication in their medicine cabinet because it's very accessible. You can find it at your local pharmacy. But there are also other routes of administration, such as intravenous or intramuscular. There's also the atopic route, which refers to application in creams where it's highly protein-bound. This type of administration is generally prescribed by dermatologists to treat various skin conditions. Now that this point is clear, it's important to understand what dexamethasone does in my body and why it's taken. Let me tell you that this drug has an anti-inflammatory and immunosuppressant effect. When we talk about its anti-inflammatory effect, we mean that it will relieve swelling, heat, redness, and even pain. But when we talk about its immunosuppressant effect, this means that dexamethasone will prevent our own immune system from mistakenly attacking our own cells and healthy tissues. That's why it's recommended, and the Gamut team will always recommend, that not only dexamethasone, but also any other drug be used under medical supervision. So, with that point clarified, we can now move on to the next question. What happens to my body when I take dexamethasone? When we take the medication with water, there will be 80–90% availability of the drug in the bloodstream. It tends to bind to protein at a rate of 70%, thus giving. The result is a 48-hour half-life of dexamethasone. When ingested, it reaches the liver, where it undergoes metabolism. What does this mean? It means its chemical reaction. Our own cells break it down so it can bind to proteins. This reduces inflammation by inhibiting two very important hormones in our body, which are the main drivers of inflammation, prostaglandins and leukotrienes. By inhibiting these two hormones, dexamethasone has its anti-inflammatory effect. With this clarified, the next important point is to mention which diseases dexamethasone can help treat. Many doctors choose to use this drug because it is indicated for diseases requiring anti-inflammatory and immunosuppressive treatment. If we're talking about oral administration, that is in tablet form, this will be very helpful against different types of illnesses such as severe asthma, severe allergic conditions, or dexamethasone is used to treat severe acute dermatological diseases, meaning conditions directly affecting the skin. It is also effective against early-stage autoimmune diseases, as dexamethasone has an immunosuppressive effect. It is also quite helpful against active rheumatoid arthritis. However, many people do not tolerate tablets, as some dexamethasone tablets contain lactose, and many patients are lactose intolerant. Therefore, dexamethasone is administered via another route. This is where intramuscular or intravenous administration comes in. This route is also useful for various conditions such as severe allergic reactions, contact or atopic dermatitis, allergic dermatitis or drug hypersensitivity, and severe allergic inflammatory processes, whether acute or chronic. What does this mean? These are short-term or long-term effects, and it will also have an effect on eye conditions such as uveitis. Later, allergic conjunctivitis, iritis, and optic neuritis are also treated. What about topical administration? Many people use this route topically, in creams, to treat skin conditions thanks to its anti-inflammatory effect because there are generalized dermatoses. What does this mean? It means that there are skin conditions that affect not just one part of the body, but also the hands, arms, legs, chest, abdomen, and even parts of the face. There are also localized dermatoses that only affect a specific area of the skin or body. With this in mind, this is where this route of administration is used. Dexamethasone is also indicated for the palliative treatment of leukemias and lymphomas. But be careful, we must keep in mind that this drug must be strictly monitored by healthcare professionals. You cannot take this drug and self-medicate. Never do that. Not only with dexamethasone, but with any other medication as well. Currently, what is the relationship between COVID-19 and the use of dexamethasone? Well, thanks to a trial analyzing the effect of dexamethasone in relation to COVID-19, it was concluded that a 10-day course of 6 mg of this drug daily provides a significant benefit to the individual or to the patient on respiratory support. Furthermore, this trial has verified that it will shorten hospital stays in patients using or undergoing treatment with dexamethasone. Here again, I emphasize that the use of this drug must be strictly monitored. Next, we have the contraindications for using dexamethasone. Patients with hypersensitivity to this drug or any part of their medical histories should discontinue its use as it can cause adverse effects. We mentioned that the tablets may contain lactose. Therefore, patients who are lactose intolerant are advised to use another route of administration for the same drug. But we also have to take into account that a systemic fungal infection, or a dexamethasone, should not be used for fungal infections. Administration of this drug is not recommended in patients using a live or attenuated vaccine. This point is very important, as antibodies may not respond adequately in our bodies and may not be stimulated, resulting in a lack of immunization and a potentially severe reaction. These are the main contraindications to consider for this drug. Does dexamethasone have a negative effect on growth in children? The answer is yes, due to its glucocorticoid effects and immunosuppressant properties. It is recommended not to use dexamethasone in children, as its use should be strictly prescribed and monitored by healthcare professionals or pediatricians. This is especially important if dexamethasone treatment is long-term, as prolonged use reduces growth rate and bone density. Pay close attention to this point. What are the most important precautions I should take when taking dexamethasone? A gradual reduction in dosage should be carried out under the supervision of a medical professional, as doses in long-term treatments should never be stopped abruptly, since this can lead to adrenal insufficiency or adrenal gland failure, because the hypothalamic pituitary adrenal axis suppresses itself starting in the second week of treatment with intermediate doses. This is yet another reason why it must be administered and monitored by your primary care physician. Only they can tell you when to discontinue the high dose of dexamethasone or any corticosteroid, as it can cause negative effects. Are there any negative effects if I take dexamethasone with other medications? The answer is yes. And here are 3 very important examples. If you are taking dexamethasone and you want to take any type of NSAID, also known as a non-steroidal anti-inflammatory drug, the risk of gastrointestinal bleeding is high, since these 2 medications should never be combined. The same applies to the combination of dexamethasone plus the drug warfarin, since this will stimulate thrombosis, which will decrease the anticoagulant effect of guaifenesin. Therefore, these 2 drugs should not be combined or mixed. What happens if I take dexamethasone plus furosemide or thiazides? It will also have a negative effect because it will increase the decrease in potassium in the body. What side effects will I experience from taking dexamethasone? Well, if you are someone who takes this drug for a prolonged period and at high doses, let me tell you that you can develop adrenal insufficiency, also known as suprarenal failure. And you might ask, what is adrenal insufficiency? Well, it's a disorder in which these glands stop producing enough of certain hormones, which we mentioned at the beginning of the video, that our body naturally secretes, such as corticosteroids. So, by consuming so much corticosteroid, we can cause insufficiency of this gland, which is very important in our body. Adrenal insufficiency can be primary, for example, it can lead to Addison's disease. Given the global importance of dexamethasone, you can now understand its actions and effects on the body. This drug is versatile and indicated in many medical specialties. It is crucial that its use always be under medical supervision as it causes many negative effects. If used incorrectly, you could experience any of the effects mentioned in this video. I invite you to subscribe and like the page if you enjoyed the video. We will also be discussing other equally important drugs. My name is Taj Aguilar, and we are the SibTaj Project. Thank you very much.